Assalamu alaikum. I am Dr. MD Mahbub Alam, Assistant Professor Current Charge, Department of Pathology of Bashundhara Ad-din Medical College. In this lecture, we will talk about the pathology of the bone. The most common bone disease that we face is the inflammation of the bone and bone marrow, which is also known as osteomyelitis. Osteomyelitis can be caused by various organisms like bacteria, virus, fungus, parasites, etc. There are some common types of osteomyelitis, which includes pyogenic osteomyelitis, tubercular osteomyelitis, syphilitic osteomyelitis. The route of entry of pyogenic osteomyelitis includes hematogenous route, which is the most common. Then there is extension from a contiguous site or from direct extension. The causative organisms include, the most common is Staphylococcus aureus, which is responsible for about 80 to 90% of the cases, and there are some other special organisms. They are specific for some different situations. For example, patients with sickle cell anemia are predisposed to Salmonella organism, and for neonates, Haemophilus influenzae group B streptococci are more frequent. Now, the morphology of the osteomyelitis. It depends on the stage, whether the patient is on acute, subacute or chronic stage. Usually what happens is, once the bacteria is localized to the bone, the bacteria proliferate and there is an inflammatory reaction. And the inflammatory reaction raises the intraosseous pressure and there is death of the bone. The entrapped bone undergoes necrosis and this dead bone is called sequestrum. And when there is a reactive bone formation around the sequestrum, that is known as involucrum. So, what are the complications of osteomyelitis? There are many complications, but most important is the pathological fracture. What is pathological fracture? It is the fracture of a bone due to minimal trauma. Since the bone is already diseased from chronic osteomyelitis, the bone is very friable and it undergoes fracture with minimal trauma. So that is known as pathological fracture. Then there is the infection may spread to other organs and may give rise to sepsis or endocarditis. Then there may be secondary amyloidosis, or there may be a squamous cell carcinoma of the draining sinus, and rarely they may give rise to a sarcoma. So that's all about chronic osteomyelitis. Now let's shift our focus to the bone tumors. The bone tumor, the most common bone tumors are the secondary bone tumor, that is the metastasis from other side. These sites may include the colon, the entire GIT tract, the lung, the breast, the prostate, the thyroid. So from anywhere metastasis to the bone may occur. And then there are some primary bone tumors. The primary bone tumors are classified like hematopoietic tumor. For example, the myeloma, the lymphoma of the bone, these are the hematopoietic tumor. Then there are chondrogenic tumor. What is chondrogenic tumor? These are the tumors which forms cartilage. They could be benign or malignant. Benign tumors example includes chondroma, enchondroma, chondroblastoma, etc. And the malignant chondrogenic tumor is chondrosarcoma. Similarly, there are osteogenic tumor. These are the tumors which produce bone. For example, the benign tumors would be osteoma, osteoid osteoma or osteoblastoma. And the malignant bone forming tumor, which is a sarcoma, it will be osteosarcoma. Then there are unknown origin of tumors such as giant cell tumor, which is a benign tumor, and malignant tumor is Ewing sarcoma. Now, to diagnose a case of bone tumor, we need three different components and each of them are necessary. Number one, we need to have the clinical history of the patient, the location of the bone tumor, etc., the duration, is there any predisposing factors. The second, we need the radiological imaging studies, for example CT scan or X-ray, which is also very important. And finally, we will need an histology or histopathology study. Final, histopathology. So to repeat, we need three elements for diagnosis of a bone tumor. Number one will be clinical standpoint, number two will be radiological assessment, and number three will be histology. For example, radiological change. There are some specific change which can be found in different types of sarcoma. For example, in osteosarcoma, we get a specific finding called Codman's triangle. So what is a Codman's triangle? It is the elevation of the periosteum surrounding the osteosarcoma is called Codman's triangle. And again, for Ewing sarcoma, we get a very specific radiological finding which is onion skin lesion. For multiple myeloma, we get multiple punched out lesions. So these radiological findings help us to differentiate between the malignant tumors. So let's talk about osteosarcoma. It is the most common primary sarcoma of the bone. Osteosarcoma. The age. It is a bimodal tumor. Maximum of the patients are below the 20 years of age, and older age people may also be affected by osteosarcoma. So what is osteosarcoma? By definition, it is a malignant mesenchymal tumor where the tumor cells produce bone matrix. This is the important point. The malignant tumor must produce bone matrix to be known as osteosarcoma. Now, why we need radiology? Because osteosarcoma usually always arises from the metaphyseal region of bone. And we know a long bone has three parts, the diaphysis, metaphysis and epiphysis. And knowledge of which bone tumor arises from which location is very helpful in diagnosing the bone tumors. So again, the osteosarcoma arises from metaphyseal region. So which bones are affected? The bone affected are most commonly the lower end of femur, the upper end of tibia, that is the bone around the knee joint, or the upper end of femur or proximal part of humerus. These are the most common sites for osteosarcoma. Now there are two classifications. One is primary osteosarcoma, which is more often in younger patient, and there is secondary osteosarcoma, which occurs in the older patients. So the older patients have some previously predisposing factors such as bone infarct, Paget's disease, previous bone radiation or fibrous dysplasia. These are the causes of secondary osteosarcoma. So morphologically, the most of the osteosarcomas arise in the metaphyseal region of long bones, and grossly the tumor is very big and bulky tumor. So when we see that tumor under microscope, as per definition, it is a malignant tumor. So the malignant tumor will form new bone matrix, and the tumor cells will show marked pleomorphism with bizarre hyperchromatic nuclei, multinucleated giant cell, atypical mitosis and necrosis, etc. Now let's talk about Ewing sarcoma, another important tumor of bone. It usually occurs in the patients less than 20 years, and the location of the bone is usually long tubular bone or flat bone. And as we mentioned, these types of lesion have onion skin finding on radiology. And the site, the bone tumor is always arising from the diaphysis. And this is also, Ewing sarcoma is also known as a small round cell tumor due to the morphology of the tumor cells. So the morphologically, the tumor cells are very small and very round and very small cytoplasm. And there is another thing that is known as Homer-Wright rosette. This Homer-Wright rosette is found in the Ewing sarcoma. Another common tumor is giant cell tumor of the bone. It usually occurs in the skeletally mature persons from the 2nd to 4th decade of life, and more common in the female. The giant cell tumor may affect any bone of the body, but usually it's around the knee joint. For example, distal femur, upper end of tibia. So the location is somewhat similar to osteosarcoma. The tumor is also known as osteoclastoma because the tumor is composed of many multinucleated osteoclasts like giant cells. The origin is always from epiphysis and sometimes may also they arise from metaphysis. And in radiology, this is also very specific for giant cell tumor, is the soap bubble appearance of the lesion. Morphologically, we will find Newszonebd osteoclast like giant cells. They have about sometimes up to 100 nuclei in one giant cell. And in the background of the tumor, we will see uniform oval to mononuclear cells. And actually, these mononuclear cells are the tumor component. And regarding the biology of tumor, the maximum cases are intermediate tumor because they are although benign but they are locally aggressive. That means they infiltrate locally. So this is all about bone and bone tumor for today. Thank you.